How are you doing?
Good.
So go ahead and bring your left leg up to my hand and then back down and then back up. And don't let me push your leg down. Good. And then do this leg up and then down, then back up and we push down. Good. And back down. Don't let me pull your leg up, okay? Good. Good. Next I want you to bring your legs together and then out and then back together. Don't let me pull your legs apart. And then out, don't pull them together. Good. Next I want you to bring your heels back to the bed and then all the way back out and then back underneath the bed. Let me pull your leg out. Good. And then extend your leg out. Bend your knees slightly for me and then don't let me push your leg down. Okay, same with this one, bend slightly. Good. Next I want you to bring your left foot over to your right leg, like this. Yep, and then back straight, and then back. Good job, don't let me move you. Okay, same with this leg, same motion, and then back that way. Good job. Great. Next we're gonna do the opposite motion of that, so I want you to take your leg and do this, and then back straight, and then back out. Don't let me move you. Same motion with this leg. Back out, very good. Okay, next I want you to point your toes up to the ceiling, then down to the floor, then back up to the ceiling. Don't let me move your feet. Good, same with this foot. Good, next I'm gonna point your toes down, don't let me move you. Good. Next I want you to point the bottom of your foot over towards the other one, just like so, and then back straight, and then point back. Good job. Don't let me move you. We're gonna do the same with this foot. Back straight, and back. Good job. Good. Next, we're gonna do the opposite motion of that. So I want you to point your foot out this way, and then back straight, and then back out. I want to move you. Do the same thing with this foot. Out, straight, and then back. I want to move you. Good. Next, what I want you to do is don't let me push your toes down, okay? If you could, please flex your toes like so. Don't want to move your toes. Go ahead. There you go. You got it. Good. Same with this foot. Good. Next, spread your toes apart. Don't want to push them together. Okay. Patient appeared to have full range of motion and tested strong in almost every area. So first, I need to find the greater trochanter. Do that. Put your hand here. Have them externally rotate, internally rotate. Greater trochanter is going to be the fulcrum for the goniometer. Put that right there. The proximal arm is going to be the midline of the body, and the distal arm will line up middle of femur, or you can come to the lateral epicondyle of the femur. So I'm going to be doing passive range of motion. So next, what you do is you pick their knee up. Make sure the patient's comfortable through this whole process. On the greater trochanter, lateral epicondyle, midline of body, leg down, and let's see what we have. We have 108. Okay, next I'm going to be doing active hip extension. So this is going to be the same landmark. So you're going to find the greater trochanter there. That's going to be your fulcrum. Proximal arm is going to be midline of body, and then the lateral epicondyle there. So, make sure there's no gap there. Good job. Okay. Go ahead and pick your leg up off the table for me, so your right one. And when they do this, you want to make sure that their hip is not leaving the table. Go for the greater trochanter still. Make sure you're still on it. Midline of body. Condyle. Keep holding, you're doing a fine job. And you can go ahead and drop. And he has 13 degrees. So next we're going to measure dorsiflexion. So the fulcrums will be on the lateral malleolus. The proximal arm is going to be lined up with the fibular head. The distal arm is going to be parallel to the fifth metatarsal. And the starting position is going to be his foot in 90 degrees. So if you could, sir, go ahead and hold your foot there for me at 90. And then go ahead and dorsiflex. Bring your toes up. Good job. Go ahead and relax. Now let's read here. He has 16 degrees. So next we're going to be taking passive plantar flexion. So the fulcrum is going to go on the lateral malleolus. The proximal arm will be lined up with the head of the fibula. And the distal arm will be parallel to the fifth metatarsal. You need to make sure his foot's in 90 degrees. That's the starting point. So you passively take him to 90. Line up with the fibular head. Lateral malleolus there. Parallel to the fifth metatarsal. Next I'm going to passively move his ankle down. Sir, let me know if anything hurts. Okay. And he has 34 degrees. As you can see, some of the patient's ranges of motions were found here. They were all limited except for his ankle dorsiflexion. Next, I'm going to be testing the length of your distal hamstring. In order to do that, I need your hip to be at 90 degrees, and then I'm going to passively take his leg up to extension. And for men, it's normal to have 141 degrees. Sir, just let me know if anything hurts, all right? Yeah? You feel okay? And that's 141 for sure. The next test we're going to be doing is called the Thomas test. So it's going to be testing the tightness in iliopsoas and rectus femoris. So if I could have you just sit on the very edge of the bed, yep, and then lean back, and I'm going to pick your legs up. You go ahead and lay down, sir. And I want you to hold your right leg there, and then I'm going to slowly lower this leg down on the table, okay? What I'm looking for is his knee to be bent at 80 degrees. We're testing rectus femoris now. It is not. So I'm going to do is I'm going to come over here and I'm going to measure this angle. Fulcrum is going to go on the greater trochanter. Proximal arm midline of body. This is going to be lined up, the distal arm lined up with the lateral condyle of the femur. As you can see, he has 10 degrees there. All right, next what I'm going to be doing is, to rule out that, we're going to next extend your knee out, and then we're going to drop it as well. We got iliopsoas. And we're looking for 10 degrees of hip extension. We're going to measure this because I do not believe he's met that. Greater trochanter, fulcrum, proximal arm, midline of body. Distal arm is going to be the sorry, wrong way there. Okay. Drop the condyle again. All right. And he has 12. For the patient's distal hamstring length, it was visually estimated that the patient was well above 141 degrees. For the Thomas test, with the knee bent and lowered slowly, the patient did not achieve 80 degrees of flexion at the knee and did not get 10 degrees of extension, so it suggested that rectus femoris could be tight. So then the knee was extended and lowered slowly, and he still did not obtain good hip extension, so both iliopsoas and rectus femoris could potentially be tight. I'm going to be testing your hip flexor muscle, so I want you to bring your knee up to my hand. All right, so I want you to go ahead and lay down on your right side for me. I'm going to take you into an anti-gravity position. So I'm just going to pick your leg up, and then I want you to just move through position. So I'm going to take you here. Now flex your leg up as far as you can. Good. Then back down for me, that starting position. And then back up, actually. And then don't let me move you, okay? All right. You can go ahead and sit back up. All right, next I'm going to test your knee extension. So I want you to bring your leg out for me, all the way to my hand. Yep. And then a slight bend, and don't let me push your leg. All right. I'm going to be testing his tibialis anterior. So I want you to bring your toes up to the sky and then invert your foot that way. Very good. And then don't let me move, okay? Don't let me move your foot. Good. The manual muscle test for hip flexion. The patient was unable to hold in starting position, so he was placed in an anti-gravity position to determine if he had full range of motion at his hip. He did, and he was able to resist with slight resistance in anti-gravity position, so a grade of 2 was given. For knee extension, the patient was able to hold in the starting position, but was unable to resist minimal resistance, so he was given a grade of 3. And for tibialis anterior, for dorsiflexion, patient was able to hold in starting position and resist maximal resistance.
My name is Eli, and I approve this message.